The indispensable importance of continued collaboration within international organizations on public health issues is underscored yet again today as we witness the emergence of the Ebola crisis.
Our cooperation has so far proceeded, broadly speaking, along 3 avenues, again interlinked. First of all, coordinated technical assistance and capacity building activities. Secondly, joint analysis, of which the trilateral study promoting access to medical technologies and innovation is the prime example. And thirdly, joint policy fora, like this one.
Universal health coverage, which is our guiding principle, is not possible without innovation and sustainable supply of affordable medicines and health technologies. But what are the benefits of innovation if the people who need the new medicines cannot access them?
Today, ladies and gentlemen, we look at the relationship between innovation and access to medical technologies from the specific perspective of middle-income countries. And although it is hard to generalize, I think it's still safe to say that middle-income countries are in a specific situation in at least 3 respects. Firstly, they're becoming increasingly important players in the geography of innovation, including in the area of medical technologies. Secondly, they are increasingly important markets also for medical technologies. And finally, as has been pointed out, middle-income countries typically still have large segments of poor people among their populations and therefore face a particular challenge of ensuring access to innovative health products.
The pharmaceutical industry considers many of these countries as important markets where they want to grow. The unequal distribution of gross national income in many of these countries, however, means that even a high GDP does not mean that the majority of people in these countries are well off. In reality, they are home to the largest number of poor people globally, and the absence of widespread health insurance systems means that many have to pay for medical expenses out of pocket. Ensuring access to essential products is the primary responsibility of national governments. They must focus on building national health systems that can provide quality essential health services and products at a cost that everyone can afford. The Ebola crisis again has showed the world that only strong health systems can prevent this kind of catastrophes. Strong health systems do not come for free. Economic growth can leverage people out of poverty and enhance living conditions. But to what extent this happens depends a lot on how the fruits of economic growth are distributed.
No country is or can hope to be entirely self-sufficient in medicines and medical technologies. The trading system creates a broader base for access and facilitates the kind of competition that drives innovation and cut prices.
Intellectual property, and more particular patents, have traditionally been a very important incentive mechanism for innovative activity. So patents are an incentive system that work through the market. But patents are also a means of structuring collaboration in terms of innovation, but also collaboration in terms of facilitating access, bringing a product to the market. So you can have a patent, and that patent, because it facilitates contractual arrangements, can then be used to structure, for example, distribution mechanisms, or involving generic companies in a middle-income market to produce cheaper generic versions of an innovative product already at the time while the patent may still be valid in other countries.
An early landmark for the WTO was the Doha Declaration on the TRIPS Agreement and public health. This provided a blueprint for a coherent way of addressing public health objectives within the framework of multilateral trade system. It became abundantly clear that the goals of the Doha Declaration cannot be achieved in isolation, but required an integrated cross-disciplinary approach, combining the expertise and experience of all sectors concerned.
We are hoping to develop a stronger factual foundation for policy discussions. The three organisations have great expertise in their own silos of data. The challenge is how to put that together so that we, policymakers, have an overview, can understand the overall trends in each of the areas: innovation, public health and trade.
This cooperation came into being not just because by the desires of the secretariats, but it came into being by the desires of the member states of the three organizations. I think we are at a point now where we can perhaps further strengthen it and further direct it towards the real needs, especially in middle income countries, with reference to their policies, with reference to their policy coordination among different ministries, because WTO deals usually with Ministry of Trade and WHO usually deal with Ministry of Health, and WIPO usually deal with patent offices. But when we are working together, we can also make sure that at the country level these ministries and departments are also working together. And so with this coherence of policy, we can perhaps pool all the resources at international level as well as at country level to direct innovation which can improve access to the medicines and medical products which are really needed from public health point of view.